Pre-COVID, Megan and I got to work a lot together on community health assessments and really understanding our community and the struggles that they were experiencing. And we do that every 3 to 5 years at the health department by doing a community health assessment where we gather all of our partners throughout the community and ask community members what's going well and what's not going well for them. So the outcome of our community health assessment, and when we identified the priority areas that were really affecting our community, they really revolved around 4 main pieces: housing affordability in Johnson County, substance use and misuse, suicide prevention, and community connectedness. And the Department of Health and Environment has worked really closely with the Suicide Prevention Coalition and the Johnson County Mental Health Center to identify data sources and use data-driven solutions to prevent suicides from occurring. And we've seen some really tremendous progress, even in the years leading up to the pandemic, where we started seeing some decreases in our suicide numbers. And we were very concerned that in light of the global pandemic, the isolation, the stress that has come along with having a virus circulating throughout our community, lost lives from illness, we were really concerned that we would see those numbers increase and we would sort of see a reversal of the work we had done. But in looking at the data, we were very excited to see that while there were suicides, and one suicide is too many, we did see a decline from previous years. And in the same breath with that, we also saw an increase in our calls to the mental health center, into their crisis hotline. And what this shows us is that the work that the community has done to destigmatize mental health, to make it be okay if you're not okay, to reach out for help, has really been successful. We know that communities throughout the country have seen increases in suicide as a result of the stress around the pandemic. But in Johnson County, we haven't seen that. And really, it's about the resiliency of our community, the fact that people understand it's okay to reach out, that they know that there are resources for them.
One of the bright spots that's come out of the COVID-19 pandemic has really been the partnerships between the Johnson County Health Department and all of those other community entities that we work with so frequently. Typically we come around the table and we really try to think about how to solve huge intractable issues like race equity and inclusion or housing affordability. And we have done those things in the past, and I think are looking forward to a future where we can do them again. But now, we're tackling things that are happening right this minute and need to be taken care of immediately. COVID-19 testing, how to open our schools safely, vaccine availability. So, I think we've really had to work very quickly with those partners that we have spent years and years developing and making sure that, we understand each other's role in the community and we understand who we're good at reaching out to and can really, build on that great working relationship that we have moving forward. And I know Elizabeth and myself and others at the health department are excited to move forward and be able to work on some of those other broader issues as we come out of 2021.